still remember the moment when I was snowboarding down the mountain. I had a skier cut right in front of me. And in that moment, I had two choices to make. One is to hit a tree. The second choice was to hit the skier. And I chose the skier because I love trees. And I ended up wrecking and we were just rolling on the ground. And I got up and I couldn't move my shoulder. The pain was excruciating. The next day, I got an MRI. And sure enough, I had a full thickness tear in my rotator cuff. And I had a cracked scapula. I had a fractured clavicle. My labrum was torn up, and my shoulder was just beyond repair, is what it felt like. And for 6 months, I said, there's no way I want to get surgery because, like many of you, I realized that surgery may not be my best option because it leads to more scar tissue and further damage. Not only that, but it was time off work and a very extensive rehab series. And so, as I consulted with the surgeon and sought out my options and alternatives, she asked me if I had ever considered regenerative medicine or stem cell therapy. And I said, no, I'd love to learn more about that. What do you know about it? And that's where she told me, she said, you're on your own. And I don't know, but I think it might be something to try if you're that opposed to surgery. And I'm not opposed to surgery. I was just opposed to not trying everything first. And so I was so glad when I found some doctors in Texas. We ended up using a tissue allograft from an amnion source. So from a healthy mother, we used these regenerative cells and we injected them into my shoulder. And within 3 days, I had pain relief. By the 3-month mark, I had an 80% improved functionality and pain scores. And by the 6-month mark, my shoulder was just as good as it was before the accident. And now what I've learned from that is that there are methods that do work if you do it properly. And so this was 9 years ago. And since then, I've had regenerative therapies over 20 times in my body, and we've seen it deployed in over 10,000 of our patients very successfully. So in this short little training video, I'm going to explain to you the 3 phases of care that most doctors miss, and why if you bypass any of these 3 phases of care, you may be putting yourself at risk for not having the therapy work as well as it can. And so I know many of you, you've reached out to us, maybe your current patients, or you're coming in for your first visit. You may be an athlete who's looking for better athletic abilities, and wants to get out of pain from some injuries faster. You may be someone who's in their 60s or 70s, and you just want to be able to pick up your grandkids. You want your knees to function again. They've started to creak, and you've got some wear and tear on them. You put the 100,000 miles on your back or your knees, and so it's time for some help that's non-surgical and non-drug. Well, no matter where you're at in your path, we've got some options for you today, but you do not want to miss these 3 things. So let's jump into what these 3 things are, because if you're looking for permanent pain relief, there's only one strategy. And if you miss this strategy, you could jeopardize your body's ability to heal. And so first thing that has to happen is you've got to remove the triggers. So those things in your life, the lifestyle that you have, that could be your stress levels, your nutrition, your obviously the movement, the amount of impact you have on your body, all those things, including internal pathways and inflammation internally, all those things need to be removed and they need to be reset. And so the first thing that we do is we remove the triggers. And one of those triggers we found in some of the studies actually published in 2019, they found that in every single arthritic joint, you're going to have inflammatory markers like tumor necrosis factor alpha and IL-6. So the very first thing we want to do is turn those markers off so that your body can start to go into this healing cycle. Now, once we've made it through phase 1, now phase 2 is the repair phase. And repair is when your body actually starts seeing what's missing and what do we need to fix. It's kind of like when you go into a house and remodel it, the removal phase is like the demolition, right? You say, man, I'm gonna make a new kitchen. I got to get rid of the old cabinets, the old sink. And now you go into the repair. So what's damaged in the floor now that we've got the sink out of the way and the cabinets, and holy smokes, we got to put in new pipes and new insulation. And so all these things, that's phase 2, that's the repair phase. And phase 3 is the regeneration phase. And so this would be where you bring in new cabinets, you get this beautiful new floor, And in phase 3 is when you can really start to make some magic happen, because now things come to life again. And in your joints, that's where you start to regrow the new cartilage, the new ligaments, your nerves start functioning better, you get better blood vessels into the area. And so it's a really powerful process that we work through with every single patient. So the patients that we've helped are immense. I mean, we've helped patients who have had acute injuries, chronic injuries. Now, one of my patients had 17 back surgeries. Can you imagine having 17 spinal surgeries? And he walked in and I said, I don't know if we can help you, but we'll do our very best. I can promise you that. And he said, my number one goal, Regan, is I just want to get off disability. If you can help me do that, I will love you forever. And that's no joke. We got him off disability within 6 months. He was working again as an electrician. And that was a really exciting moment for us. But we see this all the time. If you follow these 3 phases, there's no reason why you can't get the results that everyone else has. And so the way that we do this, you're probably saying, okay, well, what's in these 3 phases? Well, when you come in for your evaluation, we'll decide what treatments are going to be necessary for you to get to the results that you need to get to. In most cases, I know many of you are asking, well, does my insurance cover it? And how much does it cost? And what are some of the treatment options? And so some of the treatments that we do might be something as simple as peptide therapy. Now, peptides are these novel structures that mimic the body's ability to heal. So you have a peptide called thymosin beta-4 that activates stem cells in your body. And maybe you're saying, what's a stem cell, Regan? Well, that's the young, undifferentiated cells in your body that need to be called into action if we're going to have some real healing. And so that would be what one of the peptides does. Another treatment is what we use or what are called allografts or stem cell recruitment. So the very first phase of the regenerative process is we put in a tissue. So it's a tissue from umbilical cords, and in umbilical cords, researchers have found dense supplies of stem cells, dense supply of growth factors, of cytokine, of exosomes, of these extracellular vesicles, of RNA that sends communication patterns all through your body. And the best part about it is there's no tissue rejection. We don't have to do some crazy matching. It's very simple, easy. These treatments, it's the same treatment I've had on my shoulder, but we use that to start as a foundational piece. For most of you, insurance does not cover this, but what they do cover in many cases is the aftercare. And when you come in, one of our guarantees to you is that we'll give you 100% clarity on the treatment plan. And typically we lay out a treatment plan that lasts up to 12 months because we find that for many of you to get real healing, it's going to take about 12 months for us to get that cellular regeneration that you need so that the treatment is permanent. Not like you're coming in every day for treatments, don't worry about that. But once we work with you for a certain period of time, your guarantee is that you'll have a clear plan of action, and we'll let you know, here's what your insurance covers, here's what it doesn't. But we do find that most patients, we have single moms, single dads, retirees, a lot of fixed income, and they can find ways to afford our care. So we don't want that to get in anybody's way. So we do have great monthly payment options for the care that's not covered by your insurance. The thing that your insurance covers, especially Medicare, is going to be some of what we call the amnioflow. And the amnioflow this is a morselized and sterilized part of the amniotic fluid. And that's full of growth factors, and those growth factors help feed the stem cells and help your body regenerate that much better. We found that the tissue regeneration in knees, for example, you can get up to 2 millimeters of tissue regeneration. So it's been a very powerful treatment that might be exactly what's necessary for you. But once again, as you come in, these will be some of the treatments that our medical team will recommend to you based on what your conditions are. So I hope this has been helpful, but remember, the biggest thing I wanted you to get out of this video is don't miss these 3 phases. If you bypass any one of these 3 phases, and there's a lot of details that go into each one of them, if you miss that, then you could miss the very opportunity that you have to heal. So once again, Regan Archibald, I'm a founding member of Anodyne. I'm also a licensed acupuncturist, functional medicine practitioner, and I'm a stem cell expert. I've done research on this for a decade now and seen it work in many people's lives. I've written books on it, created educational curriculums. And so if you have any questions about this, don't hesitate to reach out to me. Regan at anodyne pain.com. So look forward to seeing you and next time. Take care.